Diabetes is a problem that lots of people have. It can cause small issues that you should pay attention to, but sometimes it can cause big problems. Knowing these signs can help you get help fast and avoid big problems. Here are 7 important signs of a diabetes that everyone should know about, whether they have diabetes or not. First, we have night sweats. Night sweats happen when you sweat a lot while you sleep, even if the room is cool, which can be a sign of diabetes. These sweats can show that your blood sugar is too low at night. Many things can cause this, like some medicines, insulin treatments, not eating right, or exercising a lot before bed. Waking up all wet not only stops you from sleeping well, but also means your blood sugar is dangerously low. To deal with night sweats, it's important to check your blood sugar regularly, especially before bed. Figuring out what causes them can help a lot. Also, your doctor might need to adjust your medicines to be safe. Having something sugary nearby, like glucose tablets or juice, can save your life if your blood sugar drops too low at night. Additionally, restless leg syndrome is another issue to consider. If you're finding this video helpful, please subscribe to our channel. Next, we have restless leg syndrome (RLS). Restless leg syndrome, also known as ALS, is a problem where you feel like you have to move your legs all the time. Your legs might feel tingly, itchy, or like something is crawling on them. This feeling can get worse when you're not moving, especially at night. People with diabetes often have ALS along with another problem called peripheral neuropathy. This happens because their blood sugar levels are too high for too long. To deal with ALS when you have diabetes, it's important to keep your blood sugar levels normal. This can help prevent neuropathy and ALS from getting worse. You can also try making some changes to your lifestyle, like drinking less caffeine and alcohol. Doing moderate exercise regularly can help, but be careful not to overdo it, as that might make the symptoms worse for some people. Massaging your legs, using warm or cool packs, or trying relaxation techniques like meditation can also help you sleep better. Sleep apnea is a sleep problem where you stop breathing for short periods or breathe very shallowly while you sleep, which makes you wake up often. This is a big concern for people with diabetes because it can make it harder for insulin to work and control blood sugar levels. Next, we have nocturia. Nocturia means needing to pee a lot at night, which can mess up your sleep and make you uncomfortable. It happens for different reasons, like drinking too much before bed or taking certain medicines. But sometimes it can also be a sign that something's not right with your health, like having diabetes. Diabetes is a big health problem that affects many people all over the world, and more people are getting it. People with diabetes often have to pee a lot at night. Dealing with nocturia if you have diabetes means doing a lot of things. You have to keep an eye on your blood sugar levels, change your lifestyle by eating better and moving more, and go to the doctor if you think something's wrong. Next, we have nighttime hypoglycemia. Nighttime hypoglycemia means having low blood sugar levels while you're asleep. It's a big worry for people with diabetes because it can happen without them knowing, which can lead to problems. Signs of nighttime hypoglycemia can include sweating a lot at night, having intense dreams, or waking up with a headache. If it lasts a long time, it can even cause seizures or make you pass out. Managing nighttime hypoglycemia is really important for people with diabetes. To do this, it's crucial to check your blood sugar regularly, especially before going to bed. If it's low, eating a snack with lots of carbohydrates can help stop your blood sugar from dropping more while you sleep. Sometimes, you might need to change when you take your insulin or other diabetes medicines, and your doctor can help you with that. It's also a good idea to keep something sugary close to your bed, like glucose gel or tablets, in case you need it quickly. Teaching your friends or family about the signs of severe hypoglycemia and how to give you emergency sugar or injections can save your life. Next, we have fruity breath. When someone with diabetes has fruity breath, it means their breath smells sweet or fruity, which isn't normal. It happens because their body has too many ketones in their blood. Ketones are made when the body burns fat for energy because it can't use sugar properly without enough insulin. Usually, some ketones are removed from the body when we pee. But if there are too many, they build up in the blood, causing a condition called ketosis. When the level of ketones gets too high, the body tries to get rid of them by breathing them out, which causes the fruity smell on the breath. For people with diabetes, especially type 1, fruity breath can be a sign of something serious called diabetic ketoacidosis, DKA. DKA happens when blood sugar levels get very high, and there are too many ketones in the blood. If not treated quickly, DKA can lead to dehydration, swelling in the brain, coma, or even death. DKA can be caused by things like missing insulin doses, being sick, or other problems that mess up the body's metabolism. So, if you notice someone with diabetes has fruity breath, it's important to get them medical help right away. It's not just a strange smell, it could be a sign of a dangerous problem that needs immediate attention. Next, we have rapid breathing. When someone with diabetes breathes quickly or has trouble breathing, it's not a small problem. It could mean something serious is happening inside their body. Our breathing helps balance acids and carbon dioxide, CO2, in our bodies. If there's too much acid, the body tries to fix it by breathing out more CO2 to make things normal again. In diabetes, fast breathing often means something called diabetic ketoacidosis, DKA, is starting. DKA happens when the body can't use sugar for energy because there's not enough insulin. So, it starts breaking down fats instead, which makes acidic substances called ketones. When ketone levels get high, the blood becomes more acidic, and the body breathes out CO2 faster. This makes breathing fast or hard. It's not just the lungs working harder. It's the body trying to fix a very serious problem. As DKA gets worse, it can cause other big problems, like coma or even death, if it's not treated. Knowing that fast breathing could mean DKA is starting is really important for anyone taking care of someone with diabetes. It means they need to get medical help right away. Next, we have nausea. Feeling queasy or throwing up are common signs of being sick. But for people with diabetes, these symptoms might mean something serious is going on inside their bodies. They could be signs of a dangerous issue called diabetic ketoacidosis, or DKA. When someone has diabetes and their body can't use sugar properly because there's not enough insulin, it starts using fat for energy instead. This makes acidic substances called ketones. If there are too many ketones, they can make the blood too acidic. When this happens, it can make the stomach feel upset, leading to nausea and vomiting. But it's not just about feeling sick to your stomach. Your body makes you feel sick and vomit to try to get rid of these extra acids. If the ketone levels keep going up, it can really mess up the body's balance and make the blood too acidic. This can cause problems for different parts of the body in people with diabetes. So, feeling queasy and throwing up aren't just signs of feeling bad, they're like warning sirens. They show that there's a serious problem with how the body is working, and it needs to be fixed right away. Ignoring or brushing off these symptoms can let DKA get worse and cause big problems, even life-threatening ones. Last, we have confusion or altered mental state. When blood sugar levels get too high or too low, it can affect how the brain works. This can make people feel confused, dizzy, or not like themselves. For people with diabetes, Having low blood sugar for a long time can lead to something called diabetic ketoacidosis, DKA. DKA happens when there are high levels of ketones and sugar in the blood, which can affect how the brain works. On the other hand, if blood sugar gets too low, it can stop the brain from getting the energy it needs, causing similar problems. These changes in how the brain works aren't just side effects, they show that something is really wrong with the body's balance. When someone with diabetes has these symptoms, it's important to get help right away. Fixing the main problem quickly can stop it from causing more problems and keep the person healthy.